So we've heard a lot about disruption today, and in the talks before our talk, you heard that it's a bit more difficult in healthcare. And the question posed to us was, where's the Google of healthcare? Why don't we see it yet? And the reason is healthcare is different. And we won't have one Google of healthcare, we will probably have 12 Googles of healthcare. And why is healthcare so different? I think if you want to go into theory, and I won't, but here's something that you can look up, the principal agent problem. Basically meaning there's a lot of skewed incentives of old pressure groups that defend their rights and wrong incentives in the system. The system is also a regulated system, something that investors usually shy away from. And it's also a complex, nonlinear system, meaning it's very complicated. So basically, we're looking for Googlish businesses ahead. And we see some of them, mostly at early stage, and many of them under attack from the old incumbents. Where will we see those businesses? We think that most of them will be driven by the two big megatrends, access and data. And today we have some speakers here who will quickly introduce themselves right after I've sprinted through this introduction about artificial intelligence software, direct-to-patient solutions, and platform solutions. And this is the panel that we'll discuss now. You've heard me. I'm a consultant in healthcare, and I pass on to Daniel. Quickly introduce yourself and your company for your first round here.
Sure. So medx is a clinical decision support software company that was founded 4 years ago. The main office is here in Berlin, Germany. We have some offices in Munich and in Cambridge in England. And we were founded with the mission to help doctors make better diagnoses. By now, our reasoning engine and knowledge base work very well. We're piloting them in the UK and in Germany, and we're covering thousands of medical conditions and symptoms with high accuracy, so that we are able to say that we cover about 99% of all doctor visits that a primary care physician would have. Our next step will be to also offer the platform to patients and then eventually link patients and doctors and build a global platform.
I'm Juliane Zielonka. I'm the co-founder of LARA Companion, which is a digital solution that helps women and couples trying to conceive to become pregnant without stress. The problem we are solving is that 72 million worldwide suffer from infertility, and it's not clear if it's the man or the woman or the couple on the mixture. So we offer digital health courses that helps them to reduce the stress, to increase the chances of becoming pregnant by collecting the data through a smartphone application, which they can provide to the physician, so the physician has a much broader diagnosis window to give the right treatment at the right time.
Yeah, hi, I'm Ulli. I'm founder of XLHealth, and XLHealth is a VC that specializes on digital health startups. We are early stage, so 500K to 5 million tickets. And what makes us special, and that's I think also why Roman called it platform solutions, is we're partnering. We're partnering with those incumbents that you said might be fighting the new entrants, and especially partnering with a very big company called CGM that is a market leader in EHR, practice management, billing, and clinical information software. Together we try to build exactly that, the disrupting business.
Oh, by the way, we have IBM as a partner, just for the records.
Yeah, my name is Frank Neumann, and I worked for the past 30 years as a CEO for a German health insurer for a sickness fund on the state side, and also for private health insurance business in Germany. And since the 1st of April, I worked as a partner in Roman Rittweger's network and as a consultant.
Yeah, and what we'll talk about now is why we don't see a Google of healthcare, and there are some reasons for that. Maybe we will go through the row and tell us the reasons, the problems that you see that have made the Google of healthcare not appear yet. Daniel, how is it with you?
So you mentioned a few. Highly regulated market. But I would actually disagree a little bit, because I think Google is in healthcare to some extent, because if you think about the patient journey nowadays, if you think about it 20 years ago, you would start, picking up the yellow pages looking for a doctor or something like that. Nowadays, if you have a medical problem, many people start at Google. The problem with that is that the results you get are sort of, unstructured, they're not curated, so they can be very confusing, and there's a lot of information. But to that extent, I would say Google is already somewhat in healthcare, aside from the fact that they are heavily investing in healthcare through their ventures arm.
I would add that if you want to be successful in healthcare, you have to know two markets. You have to know the regulated healthcare market on the one side, which is regulated because you end up dead. And the second one is the consumer market, consumer health, so-called in Germany a secondary healthcare market. And you have to understand how these forces work. We Germans do not really have an awareness that healthcare is cost effective. We do not really pay for healthcare because we have a triangle of the health insurances. And for us entrepreneurs, it's really a struggle to find the right business model. The Google of healthcare will be those who understand to solve a need on the consumer side and then jump into the first market with a reimbursement, for example, of health insurers or anything that makes it possible that they can get a reimbursement payment. But it takes time. It takes time because there is not much knowledge outside the system if you come not from the healthcare business. It's my opinion.
Well, I think maybe it even starts with the word disruption. I used that word earlier on in this panel already, and usually I don't do that. And when I remember the speech of Jessica from Bayer, disruption implies that you kind of destroy or kind of disfigure something, and then you rebuild it differently, and eventually you do something good, obviously. But disrupting healthcare, is that what we want? Definitely it's not that what those people want who are already in the healthcare industry. And if we look at some economic figures like annual spending on healthcare, it's a massive industry. It's way bigger than the automobile industry, for instance, in Germany. And those guys, they don't want to be disrupted. And I think health is also a pretty serious issue. We all are affected in our health sooner or later, and hopefully later. And we don't want to be the first ones to experience a disruptive technology necessarily. You want to have it safe and sound and not disruptive and fancy. So maybe the word already is implying some difficulties here.
But I wish it would be faster, because usually in healthcare, if you have an innovation, it takes up to 10 years. Due to the medical research, you have to have scientific proof. And then 10 years, you have so many missed chances. This, especially for people with chronic condition or infertile couples, time is really so crucial.
So if you need Google in Germany, you need a CEO for a Google in Germany in healthcare. And can you imagine that the Minister of Health in Germany is the CEO of Google? So where does the innovative thinking comes from? And as Daniel mentioned, the strong regulated system here in Germany, as we have on the one hand the sickness funds with very strong regulated, I tell you, and on the other hand, we also speak about the private health insurance business in Germany, which is not really private. It's still even the same regulated by law. So the first thing is the strong regulated system especially comes not from the side that I would say that only the politicians, but it's strong regulated for the insured too. So we don't have a system which is not a fee-for-service system. So it's principal benefits of kind. So you have your card, and you go to the physician or to the hospital, and you don't even see what happens there. There's no transparency about the process, about the products, not about the quality there. And at this conference are people who say, well, we do talk about consumers in healthcare, we talk about patients. Healthcare business in Germany on the insurer side only talks about insured. We don't have any really consumer business in healthcare here in Germany at this stage.
And question to the audience, when you think of your health, how many times do you think of your insurer? Yeah. It's not connected. It's only the flat rate you pay each month for sickness. So that is also a paradigm shift that needs to change sooner or later.
Yeah. Daniel?
I would like to add one thing about my previous response about which has to do with the investment climate. I think one of the reasons why healthcare startups are lagging or are just now starting to really develop and take off is that many investors, traditional internet investors, they have shied away from healthcare because they didn't understand the market. They thought it was over-regulated. And they didn't really recognize the opportunity. I think this is starting to change. As usual, it's changing first in the US, where I just recently read a Forbes article from 2013, and they listed, I think, 7 different healthcare startups in the US and asked investors and entrepreneurs if any of them will be a $1 billion company in 5 years. And I think about a third of the investors said none of them will be one in 5 years. And actually all of them became a $1 billion company within 1 year. So I think investors have to recognize that there's a huge opportunity.
Yeah. Thanks, Daniel, for taking away the gloomy part of our discussion. Obviously, in a true Germanic fashion, we have delved into the problems of healthcare. There are problems, but the 3 of you are asking investors for money to spend in healthcare ventures. So what are you telling them? How will you get across those problems? Ulli, you want to start?
I think, first of all, it's important to name the problem. And before, I just said disruption, we don't want that, and so on. But there are problems in healthcare. And talking about healthcare, we already imply the care part to the health. But I think healthcare starts way too late. It starts when the health problem materialized. When you are changed from a human being to being a patient just by the act of receiving a diagnosis. But imagine type 2 diabetes, for instance. We probably, from a statistical perspective, everybody has 1 or 2 relatives who's suffering from type 2 diabetes. And the patient journey goes like this. No, the human journey goes like this. There's something like 20 to 30 years where you could do something against this diabetes to materialize. You can exercise, you can change your nutrition, you can watch your body fat, and all that. But usually, healthcare doesn't care and doesn't support in engaging this behavior. Instead, nothing happens, 20 or 30 years, and then you go see a doctor, and the doctor says, well, you have diabetes now. But then it's too late. You can manage the disease, you can lower costs, you can prescribe great medicine, but you cannot change the diagnosis again. It's over. But if you start 20 years earlier with digital health, not with healthcare disruption, but with software applications, for instance, that support you in a healthy lifestyle and a healthy behavior, you can really start at the root of the problem and not at the materialization of everything that went wrong already.
That's a good point, Ulli. For example, when I talk to investors, I talk to health investors. They have problems with digital health because it's outside the healthcare market where it starts, where we can prevent actually disease and help these people. When I talk to tech investors, I really talk about humans. I talk about that we are about in a situation to humanize technology, to use smart technologies for us to expand health. And usually tech investors do get it better than those investors who are really deep diving into the healthcare market because they have different assumptions when it comes to return on invest. And it takes a bit longer in healthcare or in consumer health to have this hockey stick with your break even. Why? Because the market has to adopt your solution, and you can only be successful when you really solve a human problem and not a disease problem. I think that's the key for investors as well.
Yeah, I think you have to strike the right balance between
knowing
all the barriers in healthcare and trying it nevertheless. So investors who are too deep into healthcare sometimes have tried it all before and have seen it not working before and have given up now.
In the end, it's simple: minimize risk and create profit, and profit. Health is a profit for all of us. So this is where I like to put it.
But Daniel, how are you tackling this challenge of?
So I would modify the question a little. I mean, I don't think you have to be the Google of healthcare. I think a thing that I'm thinking about a lot more right now is that I'm convinced there will be an Uber of healthcare, and that will happen within the next 2 to 3 years. There's no reason that it shouldn't happen.
What's the difference for you?
So the difference is, if you think about Uber, it has added a lot of convenience. It has improved access from any smartphone, and it has basically created a platform to match service providers and consumers. And I'm convinced that this will happen within the next 2 to 3 years. And one more bold prediction: I think it'll come from outside the USA.
And question to Frank. Frank, you've been I would say, the most innovative CEO of a German payer, and you know how hard it is to innovate in healthcare. When you hear those 3 stories, do you agree? Do they have a chance?
So first of all, I have to change the sides now to be really innovative. So as a CEO here for a sickness fund, it's less more a problem to be really innovative. So what we see is with medx, with LARA, or with XLHealth, they are all really solutions for specific patients' needs. And when they now go to the partner of a health insurer or a sickness fund here in Germany, he will ask you, well, what is the benefit of that? And can you manage to change the process in handling some special treatments there? And what we need now is, I think, not to say, well, is medx or LARA or XLHealth, is this very innovative? Is this disruption? I would say, again, the speaker here before the session says, well, we have to bring that together. I think we do focus more on patients' needs, and we do see what different competitors are offering for patients' needs, and bring that together to a care program, something like a program for the patients in specific diagnosis, and then the insurer can offer that as a product. So we don't have to see only on this or that or special product here. So bring that together in a care program, and then you have to combine that with the physicians' organizations here in Germany. Is, I think, especially needed now for the special German market here. We do have a lot of associations of physicians here in Germany, and we do not have the special single physician which you can contract with. And then let's see what happens then. But it needs the perspective, the really perspective of the patient there.
Juliane, you wanted to?
I would like to add to Frank's example. We in Germany have a volume-based system. That means the physicians get paid by the intervention. What we strive for actually with our startups is a value-based system. What does it mean? As a patient, the value is health or lowering symptoms. In our case, it's pregnancy. If you are in the shoes of an infertile couple, you go to an IVF center, how do you know about the pregnancy rates? And with our software, we can collect this data, and this data is so important once it's submitted privately, anonymously, and then also shared with, for example, insurers to make sure they can reduce costs or shift costs. And this is something that these insurers also have to understand.
So what have you learned in your journey about innovation in healthcare up to now, Ulli?
Well, answering this question and coming also back to your point, this all sounds right. And and you were talking about investors think this, investors do that. We are an investor, right, who focuses just on this digital health topic. And being confronted with a team that comes with a brilliant idea that solves problems in the health insurance industry, solves problems for payers, we would be theoretically able to support them and connect you with you guys, but if they would tell me this story again, yeah, we have to make sure that all this is evidence-based, you know, and the insurance company needs years and so on. It's all true and it's right, and it's possible to sell to insurance companies. Some of our portfolio companies did that successfully, but we would not do an investment relying on this, because we are thinking in cycles of 3 to 5 to 7 years, if you will, between investment and divestment, and we have return ambitions and so on. But if we have 7+ years for a sales cycle, I'm a little over-exaggerating here, but you know, you have a sales cycle of 2 years plus to sell something to an insurance company. And if you don't know how to do it exactly right from day one, you add this time. You do the clinical studies and this and that. And if it takes 5 years to validate a business model, we as a VC in our industry, we are unable to fund that. And that's really a dilemma, I think, and that's why we have to start with the B2C stuff. We have to start with the lifestyle, with the consumerization of healthcare. We ultimately think what's really the big benefit is helping you guys disrupt healthcare, but I think it's just we cannot wait so long. So it's really a dilemma.
Yeah, but look at the timeline now. We do now have in Germany the discussion about an e-health law, and this is very new in this year. And everyone tells in the
We only have discussions.
No. We have the law now. We have the first step made then. Other countries made the step long before. I agree.
Yeah.
I agree. Okay, but shorten it up and go with the products below the law.
Mm-hmm.
Try to speak and try to translate your idea, some cases, to the insurer. Well, some insurer simply doesn't understand what you are doing and what now is your solution to the market. And therefore, if you have translation, if you look at the new e-health law here in Germany, I think there are opportunities to go positive in the future.
True. And I'm very happy that there is this e-health law. One final remark, but we have to also admit that it is part of the implementation strategy of the telematics infrastructure, which is delayed of how many years, how many billions? It compares to Berlin airports even. And we're happy that we're slowly getting there, right? Really, and I'm really happy that we will have this e-health law. But if you read the drafts that are accessible, it's
Okay. You're
offering
right when you look at it.
No, medication plans on paper-based. It's an e-health law, yeah, with paper-based medication plans. I think something's going wrong and something is going much slower than the pace that we have to be in when we invest.
I would like to remark that law and government is nice. Google is a company first that does entrepreneurial ways, and then comes a law in California, for example, for electric cars. This is how it goes.
Yeah.
So
I would rather ask for forgiveness than for permission.
Yeah.
So I think we have to adopt this approach. And to answer your question, I have learned that innovation in healthcare takes longer to implement. But when you get there, it's so much more rewarding. I worked in e-commerce for a few years, and I'm used to getting a minimum viable product out there really quickly, get revenues, that's also nice. But in healthcare, it's kind of like building an Airbus or a Boeing. You can't build a paper plane and say, I have a minimum viable product. So, it might take longer, but the positive feedback that we get from doctors and patients already is so much more rewarding than anything I've ever done before.
I have a different perspective, because once you start building your minimum viable product, you test it with your consumers or customers. The two different parts, and it gets better and better the more you engage with your consumers.
I think the idea of a minimum viable product is certainly a good idea, but sometimes it's not feasible. And Daniel has been lucky with medx to have had investors who financed him for the last 4 years, and so he has been able to roll out a spectacular product, which he couldn't have built in the short time frame. And if you look at the best performing industry this year, it would be biotech, and they have even longer cycles. So basically, I think what we need to tell you is cycle times in healthcare are a bit longer, and you have to live with that, even if you realize that we get emotional about these things, and some of us have found some solutions to it. I would like to make a last round of questions here. Basically, if you had one wish for the future of your venture, what would that be?
Well, I would live in a system which is really innovative, and I'm very hopeful that my children would live in an innovative system in the next 10 years in Germany.
Coming back to the initial question, why haven't we seen one yet? My wish is that more and more people open their eyes. If you think back, Google starting back in the garage, it was visible. You could theoretically see it. It was just not a multi-billion-dollar company yet. And the same is happening right now. We saw something like 1,500 startups in the field of digital health in Europe, and I'm totally sure that there will be some Google-ish businesses in terms of valuation and impact. And my personal wish then is that I live long enough to see this happen.
My personal wish is that investors will step more into healthcare. Unfortunately, I cannot come to you because you have a competitor in your portfolio, so that is closed. My wish is that money is put into this seed phase, into this early stage phase, because when we save time, we save lives and we solve problems. And this is something which I really love to have. My wish would be sitting here next year and saying, hey, look, our product got into the market and we scale into the next market. That would be so awesome.
And you even create lives, you don't only save lives.
Exactly, exactly. And this time is so important, that's why. Yeah.
So in my case, it's less a wish and more of a goal. The goal is to build a global platform that improves access and quality for patients, and then to get the positive feedback. That's my wish.
So you see, in healthcare, we are working on difficult problems. We enjoy it. We are very emotional about it, and we need to explain it much better to the investor community, who usually do have some problems with regulation, with complex nonlinear systems. But I think we are making some progress, and obviously the numbers from the US are helping us. And Juliane, you want to do the finishing remark? You have 10 seconds.
I mean, if you go to AngelList, you have investors who syndicate for startups together. So why not turn it upside down and have startups that syndicate for investors? Why is it that a startup runs to one investor, second investor, third investor? Why not having a startup investors pool and turn it around? That would speed it up.
Thanks very much. Time's up. Thank you.